As Canada gets closer to legalizing marijuana in October, doctors are now reporting an increase in cases of cannabis overdose. In the past 3 years, the number of emergency room visits in Ontario for these cases has almost tripled to nearly 1,500 cases last year. Medical expert Dr. Julielynn Wong is joining me now to tell us more about this. This is a fascinating conversation, doctor, and I had no idea it was something that could even happen.
Yes, so edibles pose a higher risk of overdose because unlike smoked marijuana, edibles take a longer time to take effect. So people may consume more to feel the effects faster, and this can lead to an overdose or serious injury or death.
And with an edible, we often can see a higher concentration of THC, and that's what we're concerned about.
Right, so many users may be caught off guard by the delayed, stronger, and longer-lasting effects of edibles when compared to smoking marijuana.
So how do we even spot an overdose?
So the signs of a cannabis overdose may include severe nausea and vomiting, increased heart rate and blood pressure, chest pain, anxiety, paranoia, panic attacks, extreme confusion, loss of contact with reality, and seizures. And these reactions may lead to serious injury or death, such as a car crash or fall.
When you're looking at these types of side effects and you think, okay, if an adult has consumed this, it's one thing, but if a child has gotten into an edible and then they start feeling these effects, I mean, as a parent, that's real scary.
Yeah, so it's really important to store your edibles out of reach of kids and pets. Make sure that you put your edibles in a child-proof container. When marijuana was legalized in the United States, we saw more cases of kids accidentally ingesting edibles and ending up in the hospital.
Really? Okay, so what should we do? If this does happen to happen, what are the first steps we can take to help?
So if you suspect a cannabis overdose, you should contact your local poison control center, healthcare provider, emergency department of your nearest hospital, or call 911. Stop consuming that edible immediately. And if the person is awake and able to swallow, give them sips of water to drink. Never try to make somebody throw up.
How can you prevent an overdose? Obviously by not consuming too much, by taking the time to wait. Are there any other things that our viewers should know?
Well, the best way to prevent an overdose is to not consume edibles, especially if you've been smoking or vaping marijuana, drinking alcohol, or taking prescription drugs. If you are going to consume edibles, start with a low dose. Do not consume more than the recommended serving amount of 10 milligrams of THC, which is the active ingredient in marijuana. Make sure somebody is with you. Make sure you read the package labels so you know how much THC is in the edible that you're consuming. And as well, you just want to make sure that you wait. Edibles can take 2 or more hours to take effect, so be patient and be careful.
We've seen this in the States as legalization has happened in certain U.S. states. Do you imagine this will get better or worse in Canada after we see legalization?
Well, based on the data from the United States, it's likely that cannabis overdoses will increase after legalization.
Okay, well, Dr. Julielynn Wong, thank you so much for being here to hopefully answer some questions for our viewers.
Thank you so much.